Thank you for joining us today for this Medicare webinar series and today's topic, Medicare and other health insurance options, presented by the Pikes Peak Area Agency on Aging. We want to thank the Pikes Peak Library District for its support of this webinar series. Before we begin, we ask that you please keep your microphones muted until we reach the question and answer portions of the presentation. You can then unmute, use the raise hand function, or type your question into the chat area. And now it's my pleasure to introduce our presenter, Roma Costanza, State Health Insurance Program Coordinator and Case Manager at the Pikes Peak Area Agency on Aging. Roma, it's all yours.
Thank you, Jared. So good evening, everyone. Thank you for joining us for our last in our four-part series of our Medicare 101. Tonight, we're going to be talking about Medicare and coordination with other health insurance options. Just a quick note that I will pause during the presentation after each topic to see if there are any questions. If you have questions, you are always welcome to type them into the chat and I will address them when I do pause, or you're welcome to simply unmute and ask your question at that time. Again, this is our last in our four-part series and it's short and sweet, so we'll try and get you out of here as soon as possible. But please don't hesitate to ask questions if you have them. And and hopefully everybody did receive the email that I sent out prior to tonight's presentation that included a copy of the slides, as well as some handouts that I will be referencing during the presentation. With that, we will go ahead and get started. So again, this is part 4, Medicare and other health insurance options. As always, I am with the Pikes Peak Area Agency on Aging, which is part of the Pikes Peak Area Council of Governments. And the mission of the Area Agency on Aging is to work with our partner governments in El Paso, Park, and Teller counties to find ways to remove barriers to independent living through development of systems and programs. And this is in partnership with the Pikes Peak Library District. We have enjoyed a partnership with them for several years, and hopefully you found out about this presentation through the library. And I am the coordinator of the local SHIP program. SHIP is the State Health Insurance Assistance Program. It's a federally funded program that's available nationwide to provide free and unbiased in-depth information and education on all things Medicare and all things related to Medicare. Every county and every state has access to a SHIP counselor for this information and education, if nothing else by toll-free statewide number. And on the slide, I have listed both my local Colorado Springs office number as well as our statewide toll-free number here in Colorado. My program in Colorado Springs actually serves a total of 9 counties in Colorado, as listed on the slide. And if you call the statewide toll-free number from any of those counties, you will get our office. Just a quick review of the topics that we've covered so far over the last 4 weeks. Week 1, we talked about eligibility, enrollment, benefits, and costs of both Medicare Part A and Part B, also known as your original Medicare benefits. In week 2, we talked about the differences between Medigap and Medicare Advantage plan insurances. And in week 3, we talked about everything Medicare Part D, or the prescription drug benefit of Medicare. And tonight we're going to wrap it up with talking about other types of insurance options that might be available to you and how they may or may not coordinate with Medicare. And that includes employer coverage, which would also include COBRA, retiree coverage, military coverage, Medicaid, and the marketplace. And we are going to start with employer coverage. So for people who are becoming eligible for Medicare, but you are still actively employed, there are some things that you need to know about how Medicare will affect that employer health benefit if you have it through your active employment. The key to how Medicare interacts or doesn't interact with employer health coverage is the word active. If you are actively employed, meaning you are presently actively working, and you have health insurance through that employment, and that health insurance covers yourself and or your spouse dependents, if that employer has at least 20 employees, what you should understand is that if you are becoming eligible for Medicare, you have some decisions to make, because you can delay all parts of enrolling in Medicare in favor of continuing to work and having that employer group health coverage through that employment. And again, that's for both yourself and or your spouse or dependents. If you choose to delay enrollment into any part of Medicare because you are actively employed with group health coverage, keep in mind that you would be allowed to enroll in Medicare at a later date whenever you stop working without penalty. And not only will it be without penalty, but you would actually get an extended amount of time to enroll in Medicare from when your employment ended and your active employer group health insurance ended. You would get an 8-month window of opportunity to enroll in Medicare A and B, or A or B, without penalty. And also keep in mind that an employer cannot encourage you, cannot require you, cannot suggest to you that you must enroll in Medicare when you become eligible if you plan on continuing to work. If you are going to continue to be actively employed through that employer, Medicare should not have any effect on how your health coverage is provided to you. Whether you enroll or don't enroll, your active employer group health coverage will remain your primary health benefit. Again, the key to that is active employment. Now, you would have the option when you become eligible for Medicare to enroll in Medicare, regardless of whether or not you continue to be employed. You could enroll in Medicare Part A, which is encouraged by Social Security, especially if you are entitled to Medicare Part A at no cost, premium free, because you've earned that benefit through working. You could enroll in A and B, but again, if you're actively employed with an employer of at least 20 employees, your employer coverage would remain your primary insurance, even if you enroll in both A and B. And there may not be any financial advantage for you to have both A and B of Medicare. Or again, you can enroll or choose to not enroll in any part of Medicare. And even though Social Security does encourage you to go ahead and enroll in Part A, you're not required to. You don't have to. If you do enroll in Part A, because it is at no cost to you based on your work history, keep in mind, again, the employer coverage would be primary, and Medicare Part A would be your secondary benefit for any Part A benefit. So, for example, if you are actively employed, you have employer group health coverage, and you had to go into the hospital as an inpatient, which is the benefit of Medicare Part A, your employer coverage would still be primary and process the claim as a primary insurance. And then if there was a balance left over, that balance could be billed to Medicare Part A to see if they would be able to pay any of that balance. This may be an advantage for people who have, say, a high deductible or a large deductible under their employer group health plan. So, for example, if you have, say, a $6,500 medical deductible through your current employer coverage, you have a hospitalization that $6,500 deductible is applied to. If you have Part A at no cost to you, that $6,500 deductible could be billed to Medicare Part A as a secondary coverage, and Medicare Part A could potentially process that claim as if they were primary, meaning they may pick up the difference between your employer's health insurance deductible of $6,500 and the Part A deductible of $1,600. So they might pay that difference and you'd be only left with a balance of the $1,600 after Medicare. So in that situation, that could be a definite advantage to you to have enrolled in Part A. In other scenarios, it may not be an advantage. So if you have a health savings account or something like that, that would reimburse those costs of a high deductible health plan, that would not necessarily be to your advantage. Keep in mind also that if you do currently have active employment with group coverage And that active employer health coverage is a high deductible health plan with a health savings account. If you continue to work and you delay enrollment into Medicare, keep in mind that once you are enrolled in Part A, you cannot continue to contribute to a health savings account. And the reason being is that there could be potential tax penalties for having both. If you enroll in Part A when you first become eligible for Medicare, even if you continue to work, you would simply stop contributing to that health savings account when Medicare Part A goes into effect. But if you delay enrollment into both A and B of Medicare when you are eligible at 65 or what have you, keep in mind that you would actually want to stop contributing to your HSA up to 6 months prior to the month you intend to enroll in Medicare. And again, that's because of potential tax penalties for having contributed to that HSA and having Medicare Part A. And the reason you would want to stop contributing 6 months prior is because if you delay enrollment into Part A longer than 6 months past your initial month of eligibility, when you enroll in Part A later, after you stop working, Medicare is actually going to backdate your Part A 6 months. So your Part A benefit will be backdated 6 months, even though your Part B benefit will only start the first day of the month once you enroll. So it can get a little tricky in that situation, but certainly if you find yourself in that situation or that potential situation, you're always welcome to contact us and we can help you walk through that process and those rules and guidelines. But again, just to reiterate, you are not required to enroll in any part of Medicare if you are still actively employed with employer group health coverage, and that includes your spouse and dependents that are covered under that active employer group health coverage as well. COBRA coverage, which is COBRA stands for the Consolidated Omnibus Budget Reconciliation Act. COBRA coverage is basically a law that says that if you stop working, you retire or what have you, you are allowed or your employer is actually required to offer to continue the coverage you had through that employment for up to a minimum of 18 months. So if you wanted to continue your active employer coverage, even once you retire or stop working, because you're in the middle of medical treatments or you simply don't have Medicare eligibility yet, or maybe it's less expensive than going on the marketplace between employment and Medicare, for whatever reason, you can opt to enroll in COBRA coverage, which simply continues the coverage that you had while you were working for a minimum of 18 months. Having said that, though, if you become eligible for Medicare, once you've opted into COBRA, once you've stopped working, once you become eligible for Medicare, you want to enroll in Medicare. If you are already eligible for Medicare when you stopped working and you opted for COBRA coverage, maybe to cover your younger spouse or dependents, to give them continued coverage for some reason, keep in mind that you would still want to enroll in Medicare within the 8-month window from the time you stop working, but you could have that COBRA coverage for up to that 8 months. You would not be able to take advantage of the full 18 months as the person who was eligible for Medicare, but you would be given that 8-month window from the time you stop working to enroll in Medicare without penalty. Once you're enrolled in Medicare, you must stop COBRA. However, if that COBRA is covering your spouse or dependents, they would be allowed to stay on the COBRA for that full 18-month window. So COBRA rules can be kind of confusing and they can be kind of difficult to navigate. But again, if you have any questions or you want to go over that information, you're always welcome to call us and we're happy to walk through that with you to make sure that you're doing enrollments or disenrollments in a way that's not going to create issues for yourself or whoever's eligible for Medicare. I did include a handout in the email that I sent out earlier this afternoon that kind of had a FAQ on COBRA coverage rules and regulations that might be helpful for you. But again, certainly if you have other questions, you're welcome to give us a call and we'll be happy to talk to you about that. So that's employer coverage and COBRA coverage. Any questions about any of that before we move on? Again, if you have a question, you can type it in the chat or you can simply unmute and ask your question at the breaks. All right, I'm not seeing any, I'm not hearing any, so we are going to move on to retiree coverage. So if you were fortunate enough to work for an employer that offered health coverage at retirement, and those are becoming harder and harder to find, but if you do have that scenario, there are a couple of things that you want to take into consideration. Retiree health benefits are optional, of course, and they have become more and more optional over time. But if it is a benefit that is being offered to you through your employer at retirement, keep in mind that that employer has absolute free reign as to what kind of retiree benefits they are going to offer and whether or not those retiree benefits will actually coordinate with Medicare in any meaningful way. There are many, many different ways that employers can offer retiree benefits and whether or not they coordinate with Medicare. So there are going to be some questions that you'd want to have answered before you choose to take advantage of those benefits or not. Because the way these retirement benefits are structured can be vastly different from one employer to another. So, and the employer again has total control over how these benefits are structured and whether or not they coordinate with Medicare. Some of the most important questions that you would want to ask before taking advantage of retiree health benefits would be primarily about the drug benefit. If the retiree health benefits you're being offered includes a drug benefit, the first thing you'd want to ask is whether or not that benefit is considered as good as or better than what Medicare offers for Part D benefits. Every employer is required by federal law to provide all employees, whether they're Medicare eligible or not, with a letter every year that states that if their health benefits include a drug benefit, whether or not that drug benefit is comparable to what Medicare Part D offers. And again, this is the letter that's required by law to go out to every employee, regardless of age, every year. So you should have gotten these letters in the past. That letter becomes very important when you're looking at actually becoming eligible for Medicare. And that letter tells you whether or not the employer coverage is considered credible compared to Medicare, meaning is it as good as or better than what Medicare Part D has to offer. If that letter says that the employer coverage is not as good, then you would definitely need to think about taking advantage of that, or you would definitely need to consider enrolling into a separate Medicare drug plan. You would also want to know how or if any retiree health benefit being offered actually does coordinate with Medicare or not. Some retiree health plans are simply going to be an extension of the active employer health plan, and it may not coordinate with Medicare at all. It may not take any other insurance into consideration at all. Other employers may offer options that are specifically designed to coordinate with Medicare for their retirees. Other employers may offer to provide you with a third-party brokerage, meaning a third-party agency that is going to have agents that will walk you through a limited number of options to just go out and buy your own standardized supplement or Medigap plan, just like we talked about in week 2, just regular standardized benefits. But you would have to get them through that third-party entity By doing that, typically the employer is going to subsidize somehow that cost, whether it be a reduced premium, whether it be perhaps a standardized benefit with maybe some enhanced coverage, or not. So another way an employer might offer benefits to a retiree would be to simply provide you with a monthly or annual lump sum that you can use to pay premiums for you to go out and get your own supplement or Advantage plan or Part D drug plan. And you simply submit a receipt for the cost of those premiums for those coverages to your retiree benefit coordinator or claims processor to get reimbursed the costs to have those coverages. So there's any number of ways an employer can craft a retirement benefit that may or may not coordinate with Medicare, and you want to be sure that you completely understand how that would work for you through that employer specifically. So you would definitely want to stay in contact with your company's human resources department to make sure that you're understanding how those benefits do or do not work. Definitely, even if your benefit structure that's being offered by your past employer perhaps is designed to coordinate with Medicare or is designed to be very similar to what you could get on the open market, such as maybe a customized Medicare supplement type plan or Advantage type plan, you still may want to take into consideration the costs to see whether or not it's going to be cost effective for you to take advantage of that option versus just going out on your own. Some employers may offer these benefits, but you still have to pay the monthly premium for them. And sometimes that premium may not be as cost effective as what you could get on your own just out in the open market. So you would definitely want to take that into consideration and compare monthly premiums. You may want to compare copays or benefits being offered. You may want to make sure what deductibles might be applied by the employer plan. So, I mean, just knowing that you have that option and that it may coordinate with Medicare may not still make it your best option, and you'd want to look at the out-of-pocket costs a little more closely as well. Other types of considerations is what kind of plan is being offered as the retiree. Is it an HMO type plan where you would be limited to what providers you could use or what facilities you could go to? Is it more of a fee-for-service type option where you can use any doctor that takes Medicare and the plan will simply coordinate with Medicare? Those are all the kinds of things that you might want to take into consideration before you make that final decision. All right, any questions about any of that? All right, again, not seeing any, not hearing any. So we will move on to retired military and veterans. So if you are retired military, meaning you have put in your 20 plus years, or you're the spouse of a retired military who's put in their 20 plus years and has been honorably discharged, you are entitled to TriCare. TriCare is military health insurance, whether you're active duty or retired. But once you retire, you can continue that TriCare coverage, whether standard or prime. And then once you become eligible for Medicare, that TriCare standard or prime can automatically convert to what's called TriCare for Life. TriCare for Life is a benefit that has been specifically designed for military retirees to coordinate with Medicare. This is a benefit that took decades to come into being after the government had promised it for decades. It was finally implemented in 2004 or 2003. And it took a lot of convincing for a lot of people who had been retired from the military for several years that it was actually real, that it was actually going to do what it was supposed to do. But it did, and it is considered one of the best coverages available in the country today to go with your Medicare. So if you are a retired military service member and have TriCare, or even if you're a retired service member and you're actively employed and not using TriCare, but would still have the ability to access it, it's a good thing. And once you become eligible for Medicare, you need to keep in mind that TriCare For Life does require that you enroll in Medicare in order for you to keep your TriCare benefits. So once you're eligible for Medicare, you can't just keep it at TriCare Standard or Prime. It must become TriCare For Life in coordination with Medicare. The exception to that rule is if you are actively employed in the private sector with employer group health coverage, and you don't intend to stop working when you become eligible for Medicare, you're going to continue that employment with employer health coverage for, again, yourself or your spouse dependents. You can delay enrollment into Medicare. Because you can delay enrollment into Medicare under that circumstance, you can also delay enrollment into TriCare or TriCare For Life. But once you quit working and you are eligible to enroll in Medicare based on that situation, you would obviously want to enroll in Medicare as soon as possible, and then contact your local DEERS office and let them know that your Medicare is going into effect so that you can get enrolled into the TriCare For Life benefit to go with that Medicare. If you have access to Medicare and TriCare For Life, again, you are literally covered under the best coverage options available in this country today. It doesn't get any better than Medicare and TriCare For Life. TriCare For Life acts very much like a standardized Medicare supplement Plan G, except that it's better. Because one, it covers prescription drugs through the military, and two, it covers all deductibles. So it gives you 100% coverage after Medicare A and B, and includes a drug benefit that's considered better than Medicare Part D, and it's at no cost to you. It's good anywhere that Medicare is good for any service that Medicare covers. So you would not need to enroll in a Part D plan. You would not need any other coverage. So you would not need to worry about enrollment into a Medigap or a Medicare supplement or Medicare Advantage plan. And all you'd really have to do is make sure that your local DEERS office has all of your information up to date. Now, DEERS has gotten very, very good at making sure people are aware that they're becoming eligible for Medicare. So they're proactive in sending you a postcard, a reminder postcard up to 3 months prior to the month of your 65th birthday that kind of tells you you need to do something, or tells you what your options are when you become eligible for Medicare at 65. So they're really very proactive these days about reminding you that that's coming up. But definitely something that you would want to take advantage of when you have Medicare. Again, if you don't enroll in Medicare and you're not actively employed, you do risk losing your TriCare benefits altogether, because TriCare does require that you enroll in Medicare if you're not covered under employer coverage. If you wanted more information about how all of that works, I've listed the website tricare.mil/TFL for TriCare For Life. It's actually a really good website with some really good information. On the other hand, if you are a veteran and not necessarily retired military, and you have access to the VA facilities for healthcare needs, that is a different situation. So to be eligible as a veteran to use the VA health facilities, that is something that you have to apply for, and eligibility is determined by the VA based on disability, based on potentially income, and based on medical need. If approved under VA benefits, you could have access to the medical facilities and services and pharmacy. And I get a lot of veterans ask me if they need to enroll in Medicare, or at least Medicare Part B, the part that you have to pay for. And what I tell them is probably. VA medical care is not considered insurance. It's considered a service, but it's not considered an insurance benefit. So for people who are able to access all their healthcare needs through the VA, that's great. But because it's not considered healthcare insurance, it's not considered insurance through active employment. It does not eliminate any penalties you may incur if you don't enroll in Medicare when you first become eligible. So I get a lot of veterans ask me, why should I pay for this if I get all of my services through the VA? Which is a perfectly legitimate question. And my answer is always, the VA is great for VA related services. When you have a VA service area or you live in a VA service area that has access to medical care or medical facilities. But that may not always be the case. You may not always be within driving distance to a VA medical facility when you need one. And Medicare is good everywhere for any reason whatsoever, no matter what, anywhere in this country, period. So there are advantages to having both Medicare, which is good anywhere and everywhere for any medical need, and VA, which provides you medical care that's accessible to you as long as you are within reach of a VA medical facility. The VA pharmacy, if you have access to the VA pharmacy, is considered as good or better than Medicare Part D. So if you were to enroll in Medicare and still use the VA system for most of your healthcare needs, including the pharmacy, you would not need to enroll in a Part D plan with Medicare, because the VA pharmacy will always be considered better than Medicare Part D. And keep in mind that VA and Medicare will not coordinate with one another, meaning if you have services in the community paid for under Medicare, the VA will not pay any of the balances Medicare left over, and vice versa. There are very, very rare situations where that might be an exception, but for the most part, Medicare does Medicare, VA does VA, and whatever costs you incur under each of those benefits will not be paid by the other entity. Other advantages of having access to the VA, of course, would be to have access to their other support services, such as long-term care, whether it's in-home care through aid and attendance, whether it's nursing home care for long-term needs, whether it's home modification program assistance. All of those things that are available to veterans outside of just medical care are definitely advantages to having that VA benefit and access. And there may be several things there that would not be covered by Medicare. But again, Medicare does give you the freedom to be anywhere you are. And if you need medical care, Medicare will pay for any medical needs you have, no matter where you're at, no matter why or when. So definitely benefits to having both. And again, remember, if you don't enroll in Medicare when you are eligible, because you use the VA system for all your healthcare needs, if you choose to enroll in Medicare anytime down the road, you will have to pay a late enrollment penalty because you did not enroll when you first became eligible. VA is not considered healthcare or employer coverage, so penalties would be incurred if you don't enroll when you first become eligible. For more information on that topic, I've also listed the VA website, va.gov, that actually does have some good information on how that coordinates or doesn't coordinate. Any questions about any of that? Okay. See none, hear none, so we will move on to Medicaid. So Medicaid is a state program. It's typically funded through both federal and state dollars, and it's a needs-based program, meaning eligibility is primarily going to be based on income and asset levels. In Colorado, the Medicaid system is called First Health, or First Health Colorado, And I have listed the website, firsthealthcolorado.com, for Colorado. What a lot of people don't realize is that there are actually lots of different kinds of Medicaid. In Colorado, there are over 40 different Medicaid programs that someone might be eligible for. The most common program is going to be what social workers typically refer to as MAGI Medicaid. MAGI stands for Modified Adjusted Gross Income. Other people simply call it Obamacare Medicaid or just Medicaid, full Medicaid. MAGI Medicaid was made or enhanced or expanded due to the Affordable Care Act in 2014, which is why some people refer to it or did refer to it as Obamacare Medicaid. It is based solely on monthly income. And it does not look at somebody's liquidatable assets. It only looks at somebody's monthly income. And it is available under those parameters to people under 65 or not eligible for Medicare. Other types of Medicaid are going to vary from state to state as far as what Medicaid programs each state may have. There may be different numbers of programs available in different states, and each program is going to have different eligibility criteria, whether it's income and asset based, whether it's physical need based, whether it's diagnosis based, what have you. But because this is a needs-based program, it's always going to be considered the coverage or payer of last resort after any other medical coverage someone might have access to. There are programs available through the Medicaid system that are specifically designed to help people pay Medicare costs. They're called Medicare savings programs. We've talked about them in the last couple of weeks. They're designed specifically to help cover some of the costs incurred by Medicare, such as the Medicare Part B premium. And at the lowest income and asset levels, it may also cover some of the deductibles and coinsurances left over by Medicare after they pay first. Medicare savings programs are specific to people with Medicare of any age, but it does look at both income and assets. So you have to fall within those guidelines. There are other programs that are specific to people who are deemed aged or are disabled. Those programs are, there's financial assistance program called OAP or Old Age Pension that provides a monthly stipend or actual cash benefit designed to supplement what you get from Social Security if your Social Security income is below a certain threshold. There are the Medicaid long-term care programs, which are designed to help cover long-term care costs. Those are costs that Medicare does not cover, such as care in a nursing home or an assisted living scenario, or even custodial care at home. Those are all long-term care programs. Again, income and asset eligibility criteria vary between just those two programs alone. And there are other programs that might also fall under those aged or disabled benefit options. Again, lots and lots of Medicaid programs, things that people need to understand if you've been covered by Medicaid, especially if you have been on Medicaid or got on Medicaid during the pandemic because you lost employment or for whatever reason. If you were on Medicaid or have been on Medicaid because of continued eligibility based on the COVID-19 pandemic, keep in mind that when the pandemic ended on May 11th, that eligibility criteria changed. And so there were lots and lots, thousands and thousands of people who were continued on the Medicaid program that they had at the start of the pandemic, even if their eligibility technically had changed and they technically would have no longer been eligible for that program. They were continued on that program based on the pandemic. And when that pandemic ended on May 11th, that eligibility changed. And now the state is going to actually look at the genuine or actual eligibility for those people that may not still qualify for Medicaid. On the plus side, they're not going to look at that eligibility until your next redetermination date, meaning eligibility is looked at on an annual basis based on the month that you were initially approved for Medicaid. So the state is going to take a full 12-month window and only review actual eligibility for beneficiaries of Medicaid on that next anniversary date. So you would be allowed to continue on Medicaid until that next eligibility or redetermination date. If you delayed enrollment into Medicare because you were on Medicaid and perhaps you weren't able to get through to Social Security to enroll in Medicare, that was a pretty common problem at the beginning. Medicare and the feds have decided to provide a special enrollment opportunity for those beneficiaries that did not get enrolled in Medicare during the pandemic when they should have or normally would have. And they were able to continue on the Medicaid because they weren't able to enroll in Medicare. Now that that Medicaid eligibility is going to end because you're eligible for Medicare or became eligible for Medicare in the last 2 or 3 years, you will be given an opportunity, a special opportunity to enroll in that Medicare benefit without any penalties, but you're going to have to take advantage of that special opportunity soon. For more information, please give us a call and we'll be able to give you those specifics. But keep in mind that if you miss those windows of opportunity in the future, you may be subject to having to wait for the general enrollment period, and penalties may apply if you don't take advantage of the opportunities that the government is providing now. I included a handout in the email that I sent out earlier today that kind of gives you the income and asset guidelines for the Medicare Savings Program, for the Extra Help Program, for Part D, as well as the income and asset guidelines for some of the long-term care programs, just for your reference. If you are on Medicaid and you're worried that you're going to lose that benefit come your next redetermination, you need to know what decisions you're going to make, or you're becoming eligible for Medicare in the coming months. Again, you're always welcome to contact us and we're happy to talk to you about what your next steps might be. Any questions about any of that Medicaid benefits? Great. Well, then we are going to wrap it up with a brief discussion about the marketplace. So the marketplace, also sometimes referred to as Obamacare because it's part of the Affordable Care Act mandates, is the federal mandate that provides expanded health coverage or expanded eligibility into private health coverage throughout the nation. Most states have allowed the federal government to manage the marketplace coverages within each state. Colorado opted to manage our own marketplace for this health benefit. And again, this just provides the ability for people who may otherwise be uninsurable due to pre-existing health issues, due to not having previous health coverage or what have you, the ability to buy coverage, regardless of any other factor. In Colorado, we call our system Connect for Health Colorado. I've provided the website connectforhealthco.com. Again, this is private insurance that is available for anybody to purchase. If you don't have the option of getting coverage through an employer or Medicare or Medicaid, you may be outside of the income and asset limits for Medicaid. For whatever reason, this provides the option for you to purchase private health insurance. At the connectforhealthco.com website, you can compare the different options that are available in Colorado. You can look at all the different premium and deductible options for the different plan levels. The Affordable Care Act, as well as the pandemic, has extended and expanded potential tax credits and premium subsidies so that this kind of insurance is more affordable for most people. I'm sure you guys may have seen the commercial that says 4 out of 5 people qualify for reduced premiums. And that's because of the expanded eligibility under the tax credit and premium subsidies based on income. These programs only look at income. They're only going to look at individual gross income or family gross income, depending on who you're shopping for, to determine whether or not you'd be eligible for reduced monthly premiums for this kind of coverage, or reduced deductibles, co-pays, etc., or whether or not you'd have to, or whether or not you get tax credits for not getting reduced costs up front. There are annual enrollment periods that you would have to be aware of to get into this kind of coverage. But the options that they offer are not horrible. I've seen worse employer plans than some of the options that you can get through the marketplace. So definitely something worth looking at if you are in a situation where you are without health insurance through other means or eligibility. There are a couple of things you need to be aware of if you are currently enrolled in a marketplace benefit and are becoming eligible for Medicare. So you need to keep in mind that once you are eligible and enrolled in Medicare, especially Medicare Part A, you should drop your marketplace coverage. You can't have both typically. If you're entitled to free Medicare Part A and you already have marketplace coverage, keep in mind if you're collecting an income, you're going to be automatically enrolled in Part A. If you keep the marketplace coverage, you will lose any current tax credits or premium subsidies because of the Medicare Part A. But it's also illegal for someone to sell you a marketplace plan if they know you already have Medicare Part A. You cannot use a marketplace benefit in place of Medicare unless you have to pay for Part A. You're not entitled to premium free, and you're not collecting Social Security. So if you have to pay for Part A, you can keep marketplace coverage instead of paying the premium for Part A because the cost is comparable. Or if you don't enroll in Medicare A and B, both, and you're not collecting a Social Security income, you can keep your marketplace coverage. Once you start collecting a Social Security income, you will automatically be enrolled in Part A, regardless of how far down the road that would be. And your eligibility for marketplace coverage would end because you can't have both. And you may be looking at a late enrollment penalty for Part B if you wait too long past your eligibility for Medicare Part B. There is potentially a late enrollment penalty for Part A, but again, that's only if you have to pay for it. You're not entitled to it for free. What you can do once you're enrolled in Medicare or eligible for Medicare in the marketplace is shop for dental coverage or dental and vision coverage, because those are benefits that you can buy as standalone options. So you would be able to do some shopping around if you wanted to get some dental or vision coverage as a benefit in addition to your Medicare, because keep in mind, original Medicare does not cover those services at this time. So that would be an option to compare and shop around for those kinds of benefits themselves. Again, marketplace rules and Medicare can be a little confusing. I did include a handout, a FAQ handout regarding Medicare and the marketplace. But if you had any other questions, as always, you're welcome to contact us, and we're happy to sit down and talk to you about the steps that you need to take next. And that is it. Were there any questions about marketplace coverage? Any questions or comments before we wrap this up and let you go? All right. Well, as always, I appreciate that comment in the chat. As always, we do greatly appreciate you joining us for this 4-part series. If you do have questions, concerns, or would like to meet with a counselor anytime in the future, and keep in mind, open enrollment is coming up as well. You're always welcome to contact us. You can either call us at our local Colorado Springs number. You can call us at the statewide toll-free number. You're always welcome to shoot me an email at the email address shown on the slide. I'm happy to respond, and we're always happy to schedule appointments in any means that is most convenient for you. Hopefully you found this series informative and helpful, and you'll tell all your friends about it, because we will start this series again in January, I believe. In the meantime, there will be some limited opportunity to do Medicare 101s. I will be doing the Medicare All-in-One 101 presentation for the last presentation of our retirement series, which is available through our agency, which is covering different aspects of retirement in general, from psychological to financial to medical. And that is going on right now. And if you wanted more information about that, please go to our website, ppacg.org/events for more information. I will be doing some presentations in other counties throughout my 9-county region in the next couple of months as well about different topics. I will be doing a plan finder demo for open enrollment at the Y, I believe, sometime in September. So keep an eye out on our calendar. I will try and have Jared post all of those events locally, so that if anybody is interested in attending them, you're welcome to do so. You're always welcome to check our website for any upcoming events or flyers, or you're always welcome to contact us for information about anything that might be upcoming as well. And with that, again, I'm going to thank you one more time for joining us, and please let us know if there's anything we can help you with in the future. And I'm going to let you guys go for the evening, and adieu.